CPC exams are all about practice. After understanding the course, only practice makes perfect. Welcome back to my YouTube channel. If you are new to my channel, welcome to MedCode Insight. Hi, I am Nishaba, a certified medical coder. In the previous video, we explored the course of head and neck region in the Cpt Anesthesia chapter. Now let's dive deeper into this area by solving some questions related to both regions. Our first question is, a healthy 11th-month-old patient with bilateral cleft lip and palate undergoes surgery. The surgeon performs a bilateral cleft lip repair, single stage. Quote the anesthesia service. Option A is 00170 along with modifier P1 and add-on code 99100. Option B 00102 along with modifier P1. Option C 00102 along with modifier P1 and add-on code 99100. Option D is 00170 along with modifier P1. In this scenario, we must verify the accuracy of the provided service in addition to confirming the corresponding physical status modifier and qualifying circumstance code. Initially, we exclude options based on the suitability of the physical status modifier and the qualifying circumstance add-on code. In the given question, the term healthy patient aligns with P1 physical status modifier as indicated in all options. In this scenario, where the age of the child is below 1 year, it is important to note in chapter there are 4 combo codes, alongside which we cannot use add-on code 99100. Always remember, after checking age given in the question fits within the range specified in 99100, additionally verified that the service code given in the option is not one of those combo codes. However, the giving service code are not one of those 4 combo codes. Therefore, in this scenario where the age is below 1 year, we can use add-on code 99100. So based on this rule, we can eliminate option B and D as incorrect. After eliminating option B and D as incorrect, our next step is to verify the correct provider service. In this case, the service performed was cleft lip repair. For the remaining option A and C, let's verify the correct service. The first option 00102 is for anesthesia for procedure involving plastic repair of cleft lip, while the next code 00170 pertains to anesthesia for intraoral procedure including biopsy not otherwise specified. As the provider precisely described the procedure, we don't need to use the code 00170. So the correct code is 00102. So a correct option is option C with service code 00102 along with modifier P1 and add-on code 99100. Our next question is, a 6-month-old normal healthy patient underwent cleft palate revision. A CRNA, medical supervision by a physician overseeing more than 4 concurrent procedures, provided anesthesia. Quote the anesthesia service. Option A is 00172 along with modifier P3, AA and QK. Option B 00176 along with modifier P1, AD and 99100. Option C is 00176 along with modifier P2 and AD. Option D is 00172 along with modifier P1, AD and 99100. In this scenario, we need to verify the correct service code along with physical status modifier, hcpcs modifier and qualifying circumstance code. First, we will eliminate the option A because it has hcpcs modifier AA. which is only used when the anesthesiologist personally performs the anesthesia. We will also eliminate option C because the procedure was done on healthy patient, and in option C the physical status modifier indicates a patient with mild systematic disease. AD is given in all remaining option indicates a CRNA is involved with medical supervision by a physician overseeing more than 4 concurrent procedures. After eliminating option A and C as incorrect, our next step is to verify the correct provider service. In this case, the patient underwent cleft palate revision. The first option 00172 is for repair of cleft palate. Next service code is 00176, which pertain to radical surgery. So the correct code is 00172. So our correct option is option D with service code 00172 along with modifier P1 AD and add-on code 99100. Our next question is the anesthesia service was performed by a medically directed CRNA with an anesthesiologist directing 3 concurrent cases. Report both the anesthesiologist service and the CRNA service. The patient's physical status was P2, underwent bilateral cataract surgery. Option A with service code 00142 along with modifier QK and P2 and service code 00142 along with modifier QX and P2. Option B with service code 00144 along with modifier P2 and QK and service code 00142 along with modifier P2 and QX. Option C with service code 00142 along with modifier P3 and QK with service code 00142 along with modifier P2 and QX. Option D with service code 00142 along with modifier QK and P2 modifier into 2. In this scenario, we need to verify the correct service code along with the physical status modifier and hcpcs modifier. First, we will eliminate the option D because it's shown 2 times physical status modifier P2, which is incorrect as given in option D. We also eliminate the option C on the basis of different types of physical status modifier. hcpcs modifier QK is for the medical direction of 2, 3, or 4 concurrent anesthesia procedure involving qualified individual, and modifier QX is for the CRNA survey with medical direction of a physician. After eliminating options C and D, our next step is to verify the correct provider service. In this case, where we have to report both services of anesthesiologist and CRNA, we have to use the same procedure code along with their respective modifiers. Based on this rule, we will eliminate the option B as it has different procedure code. Our correct option is option A, which has the procedure code 00142 for lens surgery, which is also known as cataract surgery. So our correct option is option A with same procedure code 1 by QK show the anesthesiologist service and other procedure code with QX show the CRNA service. Our next question is a 43-year-old patient with a severe systematic disease is having surgery to remove an integumentary mass from his neck. The anesthesiologist began to prepare the patient for surgery at 10 a.m. and the surgery begins at 10:15 a.m. and the surgery ends at 10:45 a.m. The anesthesiologist hand over the patient care to the recovery room nurse at 11 a.m. How would you report the service and the total time in units? Option A is 00300 along with modifier P2 and time is equal to 4 units. Option B 00300 along with physical status modifier P3 and time is 4 unit. Option C 00322 along with modifier P3 and time is 3 units. Option D 00350 along with modifier P3 and time is 2 units. In this scenario, we have to check the correct service code in addition to confirming the corresponding physical status modifier and the time in unit. First, we will eliminate option A because it has physical status modifier P2, which is for mild systematic disease. Let's calculate the total time of the anesthesia service because all the remaining options have the same physical status modifier P3. The anesthesia time begins when the anesthesiologist starts preparing the patient, which is in this case is 10 a.m. The anesthesia time stops when the patient is handed over to the recovery room staff, which is correctly matches with 11 a.m. It indicates a duration of 1 hour. We calculate anesthesia time in unit based on 15 minutes increment. According to this rule, 1 hour is equal to 4 units. Therefore, we can eliminate option C and D. After eliminating option A, C, and D as incorrect, our correct option is option B. Let's verify it by checking all the service code given in the scenario. The first code is 00300, which is for anesthesia procedure on integumentary system, muscles, and nerves of head, neck, and posterior trunk, not otherwise specified. Next code is 00322, which is for needle biopsy of thyroid. Next code is 00350, which is for anesthesia for procedure on major vessels of neck, not otherwise specified. As the procedure was done on integumentary system, so our best option is the option B with the service code 00300 along with modifier P3 and time with 4 units. If you have any question or need further clarification, feel free to ask in the comment section or reach out via email. Thank you for watching. If you enjoyed the video, please like, share it. Your support means a lot to me. If you haven't already, consider subscribing for more. Click the bell icon to receive notifications. For more detailed guidelines, CPC mock or exam related questions and notes, email me at my given email ID.